Changed forever. In this series, we look at how aspects of all of our lives and society could forever be altered by the COVID-19 pandemic. When the pandemic struck, stories of hospitals bursting at the seams in Italy prompted concerns the same could happen here in Canada. And while we didn't see the same issues with overcrowding, our doctors and hospitals found themselves with a new crisis. Many were unable to safely care for their patients due to the public health dangers, and so they were forced to adapt. Dr. Taslim Nimji is the Director of Medical Innovation at Humber River Hospital. She's joining us this morning. Good to chat with you today.
You as well. Good morning.
What are the most significant innovations we've seen grow out of this pandemic?
So I think the biggest one that everybody will sort of point to first is a huge increase in virtual care. And you saw this sort of happen very, very quickly as we were very pressured to ensure that we could deliver care to our patients in that moment when we knew we had to stop and having them come into our centers. So that happened in primary care in the community. You also saw it in acute care centers in hospitals.
Are we going to see this be a permanent state going forward, do you think?
I think absolutely you will. And I think that there's going to be a real shift to look at, how can we actually build a proper roadmap for virtual that's really value driven, right? And that's for the patient. There can be potentially huge benefits as long as you take equity into consideration, but also for the system as a whole. And so really, historically, we saw a lot more virtual care happening in mental health, or we saw it happening in pockets in primary care. But you're really seeing that expand out across all kinds of spaces like emergency department care, post-operative care, where we haven't traditionally used it. And we've also used virtual care more in rural settings, but you're seeing that no longer an issue. Access is an issue everywhere, no matter where you are with COVID. And I think you're going to see that as a lasting sort of another one of those silver linings, as we like to call it, that will stay here.
In terms of challenges, when we're talking about virtual care and access to virtual care, what do you see as the biggest challenge going forward?
So one of them, of course, is around equity, right? So not everybody has access to a smartphone, for example. And so when we think about virtual care, we really have to think more broadly. It's not just about video conferencing, but virtual care is really about being able to access care without sitting in front of the person who's delivering that care to you. And so this is about leveraging all kinds of modalities that exist, but also telephone, asynchronous texting, emails to your care team, things like that. And then the other issue is that we really need to ensure that for our patients, they're not having to log into 100 different applications, depending on which doctor they're seeing, and making sure that care is better integrated for them so that their experience when they're actually engaging with different aspects of the health system is far more seamless. And you're seeing a lot more innovation happening in that space. And I think the other thing is that virtual care is not just the appointment. So it's great if you can have a video conference with me, for example, but if I want to order labs for you, I need to be able to do that. If I want to prescribe a medication for you, I need to be able to do that in an electronic way, so you don't then have to drive over and pick up that piece of paper. So it's really a broad redesign of the system to ensure that registration, forms filling out, consents, all those things that we tend to do that surround appointments, that wrap around the care, is actually also moving to a virtual space.
It is fascinating, all the innovation that has come out of this. Certainly changed forever, that's for sure. Dr. Nimji, thank you for your time today.
My pleasure. Thanks.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.